There are ways of delivering care which is not face-to-face, and the same applies to clinical work. Many patients have been switched to telephone clinics. The NHS is coming out of the dark ages and exploring video technology and conferencing, and we already have a number of platforms such as Teams and so on, which I think are actually very easy to use from the receiving point of view. Mm-hmm. I do think that the kind of telephone contact we have with patients will continue. I think it will replace a substantial proportion of clinical follow-up, because we've actually learned, all of us, that we don't necessarily have to see someone in the flesh. If you can speak to them, preferably with eye contact, but not necessarily, even telephone contact works well. It means that they don't need to leave their homes or travel long distances. And I think we should remember that the shielding or isolation situation will last for some time to come. So it's not as if in a few months we might suddenly return to normal. And there will be mechanisms for getting blood tests done more locally, feeding that to the hospital. And I know from my own experience, a number of patients have actually said, you know, they really do like the telephone contact. It makes things a lot easier for them. So I think that will stay. I think that's a positive fact, which will save time, energy, traveling time, the planet, etc., etc. So I think those are positives that are coming through, and I certainly welcome that.
And I would absolutely agree. I think that one of the changes that this has led to, and that I hope to see built on, is making services just that bit more accessible, making it easier for people to live their lives alongside their treatment. So treatment and follow-up care doesn't disrupt their lives in quite the way it has in the past. And I think it does mean that those services are likely to be more convenient. But certainly in terms of psychology, there's a lot of research that also shows that services that are provided remotely are as effective, if not sometimes more effective, around helping people make psychological change.
And I know it's something as well that organisations such as Lymphoma Action and WMUK have had to make changes as well. So we've been providing, you know, online opportunities for online meetings, delivering more information and support and education through webinars such as this. And it's something again that's going into, you know, looking at our strategies now, how we can continue to provide these alternative ways of people connecting, because yes, we've been able to engage with people who perhaps traditionally wouldn't necessarily come to a face-to-face support group, and so we're both kind of looking at how we continue to do that as well, and also to be part of that continuing conversation, I think, as well, because as you both highlighted, there's some really rapid changes that have happened within the NHS. People have come together, people have collaborated, and some positive outcomes have come out of that. And so it's really key to keep those going and have people affected by lymphoma and WM at the centre of those continuing conversations, because we don't want to lose some of the strength of what has happened in those alternatives to be provided.
For those who do need to be seen face to face, that will absolutely continue, because that actually has a very important role for many patients. But it's for those for whom non-face-to-face is appropriate, that should continue to be made available and probably get more efficient as time goes on.
We will still offer some face-to-face contact as well, but that actually there will be more choice for people coming through the service about which part of what type of contact they would like and how they might then fit getting support and treatment within other aspects of their lives.